So I thought I would share with you guys a laser skin lightening treatment that I'm going to be undergoing pretty soon here. I've actually never really heard of this within the US. Obviously it's not full body because then it probably would not be offered in the US, but it's basically for underarms or knees or, you know, under your neck, the vaginal area, the anal area, so like by like the labia. They're not actually going to be able to like lighten inside of it. I'm not sure what you'd want to call that, but basically anywhere where hair can grow is basically where they can lighten, around the anus and yeah, all those cool places. Goodness, vaginal, anal, buttocks, inner thighs, bikini line, underarms, posterior neck, knees, elbows, under breasts. So yeah, this laser, they say normally per area you may need 2 to 3 treatments, so it's not a one and done type of thing. And yeah, I think it starts for a small area. She said it starts at $150 US. I have an appointment this upcoming Tuesday, so they're going to take a look at the area that I want to get lightened, and then they're going to basically quote me a price at that time. If you've ever done lasers, like laser hair removal or anything like that in the past, you know they'll offer you a fee for if you want to buy a package. So if you want to buy multiple treatments, it'll be a little bit cheaper. You might just pay like, I don't know, $800 or $900 for 6-7 treatments, or you pay maybe close to $200 each treatment. So you can pay as you go, or you can do a package. We'll see how much it is. The area that I want to do is my vagina, so it's going to be by the I guess from the vagina to the anus. So just those dark marks. I know some people, like, it just depends. Some people, it's like their vagina is 2 to 3 shades darker than the outlying skin, and for some people it's like their vagina is the exact same color as like their leg. It was interesting because they break down, I'm just reading it off my phone, they break down what causes intimate skin darkening, and it's really interesting because not only aging can help that area darken, but also hormonal changes. So when you're pregnant, or you've just delivered your baby, I noticed that I had darkening of my skin on my breasts after I gave birth. So during the entire breastfeeding period, so that was quite a few months, I had darkening of my skin, but just on the breasts. It was very, very odd. I wasn't really paying attention to what was going down there, but now I know that down there can be affected. So any like large hormonal change, something called contact dermatitis or even STDs can make it darken down there, which is very, very interesting. They say if you discontinue using deodorants that contain alcohol, obviously this is for people who have darkening of their underarm, but I've noticed that if you switch from the stick deodorant to maybe the gel deodorant or the aerosol deodorant, usually it will lighten up at least 2 shades all by itself. That's without doing any scrubs or exfoliating under there, and that's just changing up your deodorant. So they're saying just removing any deodorant that has any alcohol, because that can darken. What else? Interestingly enough, avoid coffee, dark sodas, and artificial colors in food. That can help with discoloration in the perianal area. Is it perianal or perineal? Basically, it's the anus. So if you feel like you're one of those people who have like a dark ring around your butt, I know some people it bothers them, other people it doesn't. For me, it kind of bothers me. I know some people could care less, it's like it's a butthole, but it does bother me. But obviously those types of foods are going to be coming out, so I guess they're saying that that can also discolor it, just how they say if you drink dark like black coffees, it's gonna stain your teeth. Well, I guess coming out it can do the exact same thing. What else? Oh, this was interesting. So the use of G-strings and just very tight clothing can also make that area darker, which is funny because I love wearing thongs, G-strings, any type of small panty, but basically it rubs up against the area and that causes, laceration or burning of the skin, but basically it can darken it up. So women who wear, I guess, looser fitting underwear or just no underwear, I don't know, they could probably keep that area lighter. But these are just all things that attribute to having hyperpigmentation down in that area. It says shaving and waxing the pubic area causes more pigmentation due to heat, inflammation, and friction. Basically anything that produces heat, can give inflammation in that area. I'm a shaver, and yeah, I could tell how that could disrupt the skin, or just, make the skin tougher and darker in that area. So those are some interesting things that I did not know. We'll see how many treatments I need. There are some photos, I'll probably post them here, of other people who've done this treatment. So I've not gone in for my official consultation yet. That's going to be this Tuesday. But over the phone, I asked, is this laser safe for all skin types? Because if you guys have ever done laser hair removal, there are some lasers for that in particular that cannot be used on dark skin because it will leave kind of like little dark marks that just will never go away. The dark marks aren't very dark, but they're dark enough for you to see. So anyways, there's specific lasers that are safe for all skin types, and then there's some that can only be used for lighter skin types. She said that this laser can be used on all skin types. As far as what to expect, so like the post-treatment instructions, basically to keep all the areas clean and moisturized using gentle products. So no medicated topicals or anything like that. So if you're someone who is already lightening using other creams, then before this and after this, you're basically gonna want to stop using that. I would just maybe use something like, very, very light, like just a coconut oil if you feel like the area is a little, I don't know, overworked or dry. It says loose or disposable underwear must be worn after treatment to avoid friction. Avoid sexual intercourse 48 hours post-treatment. Avoid bathing or washing with very hot water for 48 to 72 hours. So just use tepid water, lukewarm water, and basically it's saying you're gonna feel like you have a mild to moderate sunburn after this, this 20-minute laser treatment. It says you can resume normal activities immediately, but avoid any strenuous aerobic exercise 2 to 3 days after. That's the same, kind of like the same instructions they give for after laser hair removal. Avoid direct sun exposure or tanning beds at least 2 weeks, obviously. Additional treatments may be required or recommended for desired results. And yeah, basically it's just saying that the post-op instructions are going to be different depending on the person. And of course, depending on the area, someone's post-op instructions may be different if they're doing, like, let's say under their neck versus someone who's doing like their butthole. So yeah, this is going to be very, very interesting. I'm hoping that this is something that lasts long term. Obviously, if it's something that doesn't last longer than 6 months or something, it might not be worth getting it. It just depends on how long. One thing with doing MSM and glutathione, I've noticed, well, it does lighten up everything else. Like, it's gonna take a little bit longer for those areas. Like, I haven't really seen that big of a change with those areas. But also, I haven't been using any of my topicals on it either, because the intimate areas, you really have to be very, 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 very careful. You don't want to, yeah, you don't want to keep the area too moist, or you could give yourself a yeast infection, and just, you have to be kind of careful. So I don't really put anything down there. Another warning, so of risks, I guess I should read the risks. Let me scroll up. Oh, or how it works. So they're using a Fatana SP laser, and it's non-invasive. It basically removes micro-thin layers of pigmented surface tissue. So it's going to be removing, a little bit of tissue. And it's just gonna reveal lighter skin and, yeah, have a less pigmented cell development. It says vaginal bleaching can be achieved fairly quickly. As the new skin develops, it's going to be smoother because there's also going to stimulate the collagen regeneration. So that's pretty cool. Risks. So possible risks, obviously you have an allergic reaction or skin laceration, bruising, or chemical burns. That's if chemicals are being used. This treatment cannot be performed if you're pregnant or breastfeeding. This treatment is not to be performed if you have a history of genital herpes or genital warts, as it could basically make the, because basically it could like provoke that condition and you could have a breakout. After the procedure is done, don't have sex, basically. Okay, basically during this treatment, it will make you more susceptible to STDs and HIV infection during the course of all the treatment. So I asked over the phone while I was setting up my consultation how long in between treatments, and she said about 4 weeks, which if you're getting like hair removal, it's usually 4 to 6 weeks, sometimes 6 to 8 weeks. Basically you're going off of the hair growth pattern. But for this one, it's about 4 weeks, which if you think about it, that's about the time it takes to regenerate new cells, like about 28 days for shedding the old cells and getting the new skin cells. Basically they're just saying during the treatment you're going to be more susceptible to STDs because we're literally taking off, you know, a small layer of the skin, so it's not going to look like an open wound, but basically if someone who is infected, you could just get things easier. I don't know quite how to explain it any better than that, but you know, it's not going to look like an open wound, but just know you just took off skin and you know, you're going to be more susceptible. So keep that in mind. There are risks. With that being said, I'm still going for it, and yeah, I'm excited. I'll let you guys know after Tuesday what goes down. I'm not sure if the same day that I have the appointment, if I'll also be able to be treated that same day. We'll see, or if I'll just have to make an appointment for another day. It's probably going to hurt a little bit. It says like it's a comfortable treatment, but just with my experience with lasers in the past, like yeah, especially in such an intimate area, there is some pain. I think right now there's like 2 different types of lasers for skin, for hair removal anyways, and one kind of feels like a rubber band being popped on your skin repeatedly over your entire, you know, vaginal area, and then there's one that feels like tiny needles pricking you. I honestly, I can't remember the name of both of those different lasers, but I know that I've tried both. And yeah, in such a sensitive area, it is uncomfortable, but not everyone needs to use like a numbing lotion. I'm not sure for this, since you're taking off a layer of skin, if you can even use numbing lotion. Yeah, that, I don't know if that gets in the way, but usually I've done most of my hair removal treatments without any numbing lotion, just because like it takes so long for it to even kick in. You have to get there like 30 minutes prior and then let it sit in. So I'll probably be doing it without any type of anesthetic, and yeah, we'll see the things you do for beauty, but it'll be nice just to have it you know, look better. If you do with hyperpigmentation, then if you have like really dark knees or dark underarms, then you kind of know how dark it can get down there. So to have it look like the same color as, let's say, my thigh, or let's say like my stomach, that would be amazing, because I don't know, you know, how to make this discoloration get better. And yeah, this might be the answer to all of my prayers.